everyone, you are listening to She Leads with Carly. Our guest today is Dr. Melynda Barnes, or Dr. B, as most people like to call her, who is the Senior Vice President of Medical Affairs and Research at Ro, a patient-driven telehealth company. After years of experience operating as a physician, Dr. B made the difficult decision to take her talents and help democratize healthcare for millions of patients by entering into telehealth and the medtech space. We chat about her process in spending years of doing pre-med, med school, residency, before she realized that she can make a bigger impact by integrating technology, in which she discovered the absolute best workplace and company in Ro. We also chat about the importance of diversity in all domains in the workplace, and how it is our responsibility to continue asking the right questions to ensure we are keeping those standards high. Such an insightful chat with Dr. B. I really enjoyed it, and I hope you guys do too. Hello, Dr. B. Thank you so much for joining She Leads today. I am so excited to have you on the show and just to hear your incredible story. So thanks for coming on the show.
Thank you for having me.
Yeah, of course. So, Dr. B, you are a Senior VP of Medical Affairs and Research at Ro, which is a patient-driven telehealth company that really puts you, the patient, in control of your health. So you guys are building the future of healthcare, making it, accessible, affordable, and even enjoyable. So we'll talk about Ro and what drew you to Ro. But even before Ro, you are a double board certified facial plastic and reconstructive surgeon, as well as an ENT surgeon. So we're going to talk about that. You went to medical school at Mount Sinai School of Medicine. So, okay, Dr. B, tell me now. We're going to take it back to, you got a bachelor's from Stanford, I believe in biological sciences and Spanish literature. So in this moment at Stanford, did you always know, okay, I'm going to go to medical school, I'm going to be a doctor, or how were you kind of navigating your career at this stage, and how far into the future were you thinking?
So I always knew I wanted to be a doctor.
Okay.
In fact, we have documentation. When I was in first grade, I had a Star of the Week essay that I wrote, and I wrote about what I wanted to be when I grew up. And I said I wanted to be president, I wanted to be an Olympic gymnast,
wow,
I wanted to write children's novels, and I wanted to be a baby doctor. So I already had aspirations at age, 5,
wow,
to be a physician.
Yeah.
And throughout my elementary school, middle school, high school, being a doctor, it just seemed like a natural fit. I really liked helping people, but I also really was and still am very curious, and I wanted to know how things work. And I thought that doctors were kind of a part of this, secret society, this special club, because they got to know how the body worked, which was so cool to me because we all have bodies, and yet not all of us know how they work.
Yeah.
And so I always kind of followed that path. And that speaks to even my major at Stanford. Doing biology, I thought made sense. I was also interested in electrical engineering, but I knew that my primary goal was to become a physician. So I decided to major in biology instead of engineering. And then I have a passion for Spanish language and literature. So that was kind of my fun major. And yeah, I kind of just always have been on that path towards medical school and towards being a doctor.
Yeah. Okay. So then really graduating from Stanford, you went to Mount Sinai School of Medicine. So it seems like nothing really changed. You were still going to be a physician, double board certified. Everything was on that track. So tell me, when did that mindset start to really shift to be, maybe I don't want to be a surgeon, in the OR my whole life, and really kind of transition to med tech? Or when did this shift?
Yeah. Honestly, I think probably like the second week of medical school.
Wow.
I thought, I don't know if I'm going to practice medicine for the rest of my life. I knew that I was still very happy that I went to medical school and I was going on the route to be a physician.
Yeah.
But that sort of insane curiosity and wanting to solve problems, I think of myself as a problem solver as first and foremost before anything else, like really wanting to understand what is going on, what's going wrong, and then also fixing it. And so in medical school, in the beginning, I was a little disillusioned because I was like, wait a minute, we don't actually know why some of these medications work. And we're not actually solving the problem with the medications. We're just solving some of the symptoms, but the patient still has the underlying disease.
Wow.
And so it made me I was a little bit discouraged when I realized that, like, wow, this is we're not as far along and we're not as far advanced in medicine as I thought that we were. Now, I think that's also what led me towards surgery, because it was a perfect fit for someone who wants to be a problem solver, who wants to be a fixer. Someone comes in, they have appendicitis, their appendix needs to come out. You know what you need to do. You go in, you take out the appendix, you give them antibiotics, and they're better, and you solve that problem. And so for me, becoming a surgeon was a no-brainer. I think it's same thing. A couple weeks into medical school, I thought, okay, I'm probably going to do something with my medical degree that's not traditional. I knew that. And then my second thought was I have to do surgery, because I needed to have something that had some immediacy of results, and I needed to be able to feel like I was fixing people like that day, like in that moment.
Yeah. So did you ever have that moment, second week of medical school? So, you could think, okay, maybe I can get out now instead of 4 years medical school, 4 years of residency. Like, it's a lot of, it's a lot of time. It's a lot of everything. Did you ever think maybe now's my time to get out? Or were you kind of, I'm going to finish it and then go move on to, problem solving and transitioning?
Great question. The truth is that I did not know what the alternatives were. Like I said, I'll probably do something different with my medical degree, but I was still thinking that I would practice medicine for like 10, 15, 20 years. I just thought that what the difference would be something along the lines of doing clinical research, or, being an executive within a hospital, or starting my own clinic or my own practice outside of the hospital. So I still hadn't made that leap to like actually leaving a clinical role, frankly, because I wasn't exposed to those options at that time.
Right.
So I did a Doris Duke clinical research fellowship after my second year of medical school. People typically would do it after their third year, but I did it after my second year because I was considering getting a PhD and looking more into the clinical research side of things. Or I thought this would give me some insight into other ways that I could use my medical degree on the research front. So the one time where I thought, okay, this would be a time to exit if I'm going to, was actually after medical school. During my fourth year medical school. So we have this process called the match, where you interview the programs, you then rank the programs that you like, the programs rank the applicants, and the computer algorithm matches you together.
Right.
So my number one choice was Stanford. My field of choice was ENT, or otolaryngology, which is ear, nose, throat, head and neck surgery. And I thought, okay, if I don't match, if the computer can't put me with a program, then that's a sign. And I am going to go apply to be a consultant. Because by that time I had gotten more information about what people do. And I thought, okay, consulting sounds like a natural fit for me. Like I get to go into organizations, figure out what's going on. And so I had started the process I'd gone to a couple informational sessions with McKinsey and BCG and Baines. And so that was my backup. And I was like, okay, if I don't match, I'll do consulting. And then I will, I'll use my doctor knowledge without, continuing down the pathway. Yeah. And even to this day, I'm so incredibly thankful that I matched and that I continued down the doctor path, because there's so much more information that I have learned through my experience of actually taking care of patients and being responsible for them than I could have known in that moment. There's a big difference between going to medical school and graduating and actually completing your residency training and being an attending and taking care of patients and teaching residents. And I wouldn't be able to do what I do today if I did not have that experience.
Yeah, definitely. So it brings me back to my sister's experience. So older sister, she did all of that. So I can definitely, it's kind of bringing back those memories of, the stress in matching and everything. So Dr. B, tell me, a lot of people, they spend years going medical school residency, as I said. Did you ever have this, I feel like your story is an incredible story to really teach those, girls, boys, whoever, going into medicine, going down this track, and to still be like, what, it's okay, you can still leave and go and use that knowledge that you've learned towards something else, towards either consulting, for health companies or med tech. So did you ever have these doubts? I put so much time, I put so much effort, long years, studying all nights, all that stuff to just kind of, I wouldn't say throw it away, but almost just put it aside and really go down this new track? Did you ever have those doubts?
Absolutely. Here's the thing that you have to know, and your sister will back me up on this.
Yeah.
There is no way that there's a physician who is in a non-clinical role. There's no way that that person made that decision lightly. I thought about, what I just said was I thought about doing consulting when I graduated from medical school. And yet I did 5 years of residency, 1 year fellowship. I then taught at Yale for 2 years. I then worked in private practice. So that was me deliberating. That was me thinking through what it would look like to do something else, because it's not a decision that you can make lightly. And I feel like for me, that just shows you how passionate I must be about what I do now for me to have left a field that was incredibly amazing. I love taking care of patients. I love operating, and I miss the one-on-one interaction that I have with patients. I miss making that impact in someone's singular life every day. And that's what I was doing as a surgeon. But I feel like, and I always joke, like I'm taking one for the team, but I do feel like there's a certain number of us who need to take our skill set as physicians and bring it to this larger context. Because right now I have the ability to improve the lives of millions of patients. And that's something that, if you ask me yesterday or tomorrow, like, would I exchange operating every day for improving the lives of millions of Americans when it comes to increasing access to healthcare? I'll say yes.
Right.
I miss it, but I feel like I'm equally skilled and maybe gifted in like this space as well. And then because I have the interest and the desire, I feel like it's almost my responsibility to like work in this space as well. And there are so many people who are fantastic surgeons, and I have friends who I can refer patients to. And so I feel like we are all working in our areas of expertise. And so, it is a lot. Most people still don't get it. A lot of people told me not to do it. People thought I was crazy when I left, especially coming from a competitive and desirable field like ENT and facial plastics. And like, how are you going to give that up to go work at this like healthcare startup? But I just felt it. I felt it in my gut. I felt it in my bones that this was the right move. And it was like what I needed to do to feel professionally satisfied, and also to really like just bring together all the things that I've always loved, which is like helping people, solving problems, like honestly also being a teacher. Like every day I get to explain how medicine works to my colleagues, to patients, and to have like even a platform of which to like talk about things like healthcare disparities. So I feel incredibly lucky to have had sort of these like 2 lifetimes of careers, like to have been a practicing physician. And to be honest, I still, since COVID and my maternity leave, I haven't seen patients, but before that I was still taking call at the hospital and taking care of patients on the weekend. But yeah, to have that sort of like day-to-day practicing provider and now to be a physician executive, like I feel very lucky to be able to do both.
Incredible. So cool. So now, how did you find Roe specifically? Tell me a little bit more about Roe, what you guys are doing, and then what drew you specifically to Roe.
So honestly, it's not a like sexy fine story at all. I found the job description on a job board directed to physicians who were looking for non-clinical careers. But I'll back up and say, how did I know that Roe was going to be an amazing company and be a great fit for me? I started doing my homework. Again, it's a big decision to leave. So I would say a couple years before I actually left clinical medicine, I like seriously started looking into what a transition would look like. I hired a business coach, actually the woman who works at the business school at USC. She was referred to me by a friend who went to business school there. She helped me write my resume, write a business resume. She helped me talk through translatable skills between medicine and the business world. And then she gave me the best advice ever. She said, go on Indeed and just read about different job descriptions, like type in medical director or type in like physician and see what job posts are there. And then if you can, apply for the jobs, talk to the recruiter, see what they tell you about the day to day. And if you know people who are in those roles, speak to them or reach out to them on LinkedIn and get a sense of what they were doing. Yeah. So I did that. And there were some things I was kind of like, okay, probably don't want to do this. I wasn't so big into like utilization review, things like prior authorizations for insurance companies. And that's when I started to see like, okay, I think I like this startup world. I think I like innovation and entrepreneurship. Yeah. And so I started going to a lot of meetups in New York. I joined the Society of Physician Entrepreneurs. I applied for jobs that were in smaller, like mid-cap companies that were in medical device space or pharmaceutical. And so what happened is before I saw the job post for Roe, I actually had a couple of job offers that I was considering. And none of the jobs like were 100% exciting to me, but I saw them as like, okay, this is how I transition out. Right. And then I saw the job post for Roe and I was like, okay, this is what I'm looking for. I mean, it was a mission-driven company. Yeah. They had, extremely impressive advisory board. So I knew that there were other smart people who had like bought into this idea. Yeah. They were past their Series A funding, but they weren't huge. They were looking to change the way people access the healthcare system. And they were looking to democratize healthcare. They were, their goal was to be live in every state. And so I really liked their vertical integration model. And frankly, when I met with the co-founders, I was like, okay, I'm sold. I mean, they just were so articulate in their vision and mission for the company. I felt like I had to join. I had to like be a part of it. And so I don't even know if they know this, but after my first interview, I declined the other job offers that I had. Didn't have a job offer from Roe, but I declined the others because I was like, this is where I want to work. And if they don't hire me, at least I now know the type of company and the type of work that I want to do. And so, I'm just so incredibly thankful that it worked out and that they saw something in me that hopefully is exactly what I saw in them. And very happy coming up on my 2-year work anniversary with them.
Amazing. So. That is amazing. That's also pretty risky when you think about it, just kind of putting away the other offers and just, putting all your eggs in this basket of Roe. So I love it though. I love it. So did you have any challenges, transitioning from this clinical role to now a startup? Because I know, going through medical school residency, you don't really learn those business skills. And a lot of these med tech companies are probably more so business oriented. And then the medicine comes probably right underneath or so. Did you have those challenges that it was a big learning curve or not too bad?
It was, I will credit my facial plastics training for giving me a little bit of insight into the business world because facial plastics is cash pay. So I had to work with outside marketing. I had learned even in my training about branding, about margins, about, supply chain and truly trying to provide value props to the customer. And so I had some insight, but absolutely. I actually, had meetings. I sought out some of the growth and finance people and said, hey, can I meet with you every Friday for the next month or so you can explain to me what CAC means and what LTV and can you go through corporate accounting for me? What's EBITDA and what's operating margin? And so I think, people were, surprised to see a surgeon asking for help. But that's just I don't have that stereotypical attitude of or God complex that people think that all surgeons have. Yeah. And so I was very willing to go and ask for help whenever I needed it. And so everybody was just so open and welcoming and yeah, totally. I'll walk you through this. And this is our daily flash where we talk about patients and where we are in terms of revenue and. Right. So I got to get sort of a mini crash course in business and economics, which was fantastic. Yeah. Some of the other things I probably got to work at like 7:30 the first day because I wasn't quite sure what time to show up. I was probably way overdressed because I had not worn jeans to work literally in like 10 years.
Yeah.
So I was like, I cannot go to work in jeans. I, in terms of just like meeting with people and the good thing is that surgery things move fast. You have to be able to make decisions very quickly. You have to be able to assess things very quickly. You have to be able to mitigate risk and maximize benefit to the patient. So that was perfect for startup world.
Yeah.
Like moving quickly. If they needed a medical question, if they needed a medical answer to a question, I was pretty good at assessing the information they gave me, asking the right questions, and getting that information back to them. So in that sense, we were really good. And I would actually say that like in a startup, especially in the med tech, like healthcare space, you need someone who is medical, right? Like there are tons of business people, but if you don't have the person there with a medical background to ask the right questions, you can create a company or a product that isn't actually medically relevant, that doesn't actually help people. Like it sounds good and it's something that you can do, but if you don't have the medicine there right in hand with the business, then you can actually create a product that doesn't help anybody. And so I was extremely, I think the leadership at Roe was completely on board with that and aware of it. And they had hired a physician, Dr. Doran, who was the physician who hired me. They had this, extensive medical advisory board.
Yeah.
They realized even in the beginning when they were setting up the company that they needed to have medicine lockstep with business.
Yeah. I love it so much. I don't even think you realize how many lessons you've just given in that answer, in the sense of even going into an environment, not knowing everything and having that confidence to ask, and meeting with them every Friday. I think that's so valuable and so important. And then kind of what you were saying towards the end, right now, people who are in medical school, who are in residency, to know that their knowledge is very valuable in a med tech company. And like it is, it should be used there. And so I think that's so incredible. So I want to know, I've had a lot of amazing leaders in different industries, but really haven't had many in medicine. And, med tech, whether it's med tech or, in clinical trial or whatever it may be. Tell me a little, how has your experience been as a female leader in this industry, throughout your career, and also, a person of color? How has that been? Did you experience the roles of gender come into play, and how so?
That's a great question. I will say in general, med tech, digital health tech is similar to tech. Okay. So when I was going to the meetups, it was predominantly men. Yeah. A lot of the, all of the startups that I interviewed with, the CEOs and co-founders were all men. In terms of like being a person of color, like you'll see the same thing. There's just, the companies are mostly founded by Caucasian men, and they're also more likely to get funded. So there are people of color who have great ideas, especially for like Black and brown, like underrepresented minorities in the United States. Like we have great ideas, but it's hard for us to get funded. It's hard for us to even get in the room of the VC to pitch the idea. So I think that one thing though that I have found, especially at Roe, and it may be different, but my experience at Roe has been overwhelmingly positive. We have a firm commitment to gender equity, racial equity. Our response to Black Lives Matter, to the murders of George Floyd and Breonna Taylor and countless others have been responses that I can be extremely and am extremely proud of. And the same thing for gender equity across pay, across positions. Like we actively work to host get-togethers and trainings and seminars to increase women and female representation at Roe, but in tech in general. And so I think that while the industry itself may still be more like male and more like Caucasian, there are companies that are actively fighting against that and working towards increasing the pipeline and increasing diversity. And there are a good number of founders that are people of color, one of my really good friends is the co-founder and CEO of Rubicon MD, and that's like a digital health platform, and he's a Black man. Right. I've, met with the founders of Harlem Capital, like as they are, minority owned and Black males, and they're working to increase funding for underrepresented minorities who are looking to start their own companies. So right now, there's a lot of spotlight on gender and race equity. And I think this is a time for us as consumers, as patients, to hold people accountable. Yeah. Like, where do your brands stand? Do they stand for what you stand for? If so, hold them accountable, and hold them accountable in meaningful ways. What does their representation look like? What does their board look like? What does their executive team look like? Who are they bringing in technical roles and in salaried positions and not just hourly positions? So yeah, I think I'm very hopeful. I think there's a lot of people who are interested in increasing diversity. And there are a lot of programs that are being put into place. And it's one thing, programs are always helpful, but you also have to have the jobs on the other end of the program. Right. And so working with companies to show them the benefits of increasing diversity in their workforce is also extremely important. And so in that way, we all can play a part in holding our companies that we work for accountable.
Yeah, definitely. I think that's so important. And even advice for, young females, even young females and also underrepresented minorities. Would you say just to, make sure those companies align those values with your own, and also just try and put your foot in the door? Or how would you say, maybe someone who is founder is Caucasian and they don't have that knowledge necessarily, even though that's crazy in this day, but still, what would you advise people?
Yeah, I think for one, definitely raise your hand, definitely apply. I remember being a medical student and applying for residency at this one program, and I'll keep it anonymous which program, but historically, all their residents were white men. And it's a good program, and so I thought, well, I'm going to apply. They invited me for an interview. I got down there, and just as I suspected or as expected, like, all the current residents were white men. Not only that, but the other applicants in the room with me were all white men except for another applicant, another woman of color. And so just she and I sitting in the room kind of being like, oh, why are we here? And I remember the chairman opening up his interview with me saying, well, we've never had a Black resident before. And I remember thinking, okay, quick, how do I respond to that? Yeah. And I said, well, sounds like today is a good day to like fix that problem. Yeah. It may not be me, but like, we need to be able to speak up and speak not just our truth, but the truth. And the truth is that diversity is great for everybody. Diversity of experience, of thought, of religion, of ethnicity. Like, it only adds to the bottom line of the company. So if, at Row, I think we have a great company culture where people feel comfortable raising their hand. They feel comfortable saying, hey, I would like for us as a company to do X, Y, and Z, or can we explore this? Can we talk about it? And I think that the other company, if you're at a company that doesn't have that, if you can force it by bringing up the issues, like, you get everybody one step closer to having that be the expected experience. And that's kind of how we hold people accountable. At the same time, being a person of color, there's a lot that goes along with that in America. And so it can be a lot of a burden to expect that your, Black, Indigenous, people of color are having to raise their hand and having to like do the work. And that's where allyship is extremely important. And yes, people, you might say something that's not right. Like, I'll say something that's not right. I don't know everything, and I don't know everything about the Black experience or the Hispanic experience just because I fall into those categories, right? Like, I don't speak for everyone. Yeah. But so I think we need to have grace towards people. But it's okay to ask questions and to say, how can I help? And like, just raise awareness in those respects. Yeah. No, I love it. I think that's so incredibly valuable and so true. A lot of it is just, I think it's necessary. It needs to happen. So I love it. Okay, Dr. B, we're going to end off with 2 fun questions. So first, tell me a passion or hobby that you have completely unrelated to your work. And I know that correct me if I'm wrong, but you're a certified yoga instructor, correct? Yes.
Okay, so tell me a little bit about that, and then also if this is your passion, then carry on. Yeah.
Yes. I love yoga. I started doing yoga every day in 2013, maybe. I went to a yoga class, and when we got to Savasana, and that's like the final resting pose, I just felt a relief and a peace come over me that I had not felt. Because as you can imagine, someone probably like me, I'm thinking about a lot of stuff. My mind's always active. And so to have permission to just relax was amazing. And from that class forward, I did yoga every day. And of course, I will admit that I'm an overachiever. So after doing it for like a year and a half, I thought, okay, I want to know what the teachers know. I want to know how to get into the poses correctly and everything. And so I did yoga teacher training, which was amazing, a phenomenal experience, a great way to meet other people that were different than me, coming from different life experiences. Also, I felt like it was my protected self-care time, right? Yeah. My yoga teacher training homework is like, do yoga and like practice like pranayama and meditate. And so it was fantastic. I ended up doing that. After I was done with my teacher training, I started my own yoga business on the side with the focus of focusing on professionals, especially especially men who, I felt like, okay, if you can't touch your toes, that's a problem, because as you get older, how do you take care of your like feet? How do you put shoes on? How do you stay mobile? And so my goal was that like everyone should be able to touch their toes. And so I started with the friend's husband and his friends who were all like, we can't touch our toes. And so we did a lot of modifications for yoga. And so, I think wellness in terms of meditation, yoga, eating well, like that self-care, that being centered, taking time to pause, taking time to breathe is extremely important, especially in our society where everything's like go, go, go. So that's definitely one of my hobbies and passions. And then the other thing that I do, which is probably, most people would consider it to be related to work, but I'm also on the board for the Fund for Public Health of New York City. And one of the initiatives that the fund supports is healthy mothers and babies. As we were talking about earlier, I have a 9-month-old. And when I learned that Black women in New York City were 8 times more likely than white women to die of pregnancy-related causes in New York City in 2020, it's just unacceptable. And it just became a mission of mine to try to understand why that is. How can we work to eliminate that disparity? And then it was very personal. Then I found myself to be pregnant, and then I am scared, not about labor, but about potentially not leaving the hospital because being a Black woman in New York. So I enjoy my work with them. And so that's one of my sort of passions outside of Row.
Incredible. Even the yoga, that's crazy in itself, starting a little yoga business for helping guys touch their toes to, what you're doing in New York with public health. That's amazing. So amazing. Okay. Our last question is, what is a fun or weird talent that you have that no one really knows about? So a hidden talent. So Dr. B, I'm going to go first. Okay. So I do blueberry throwing. So here's a blueberry. I'm going to throw it up and catch it in my mouth. All right, let's see. There we go.
Congrats. What is a weird talent? I don't know. I've been asking my husband, do I have a weird talent? What is it? I will say that I just have a crazy, freakishly good memory and recognition of faces. Wow. And maybe that plays into the facial plastics, but I have walked up to people and been like, we went to second grade together. And they're like,
way.
What? How do you know that? And I'm like, your name, it's coming to me.
Wow.
But I really it's really, I don't think I've ever really forgotten a face. Once I meet somebody, I have that there, and that just kind of goes into my memory bank. And so I think that's maybe.
No, that's cool. I love it.
Your talent, but yeah.
It kind of reminds me when I'm watching a movie and an actor, I could immediately know, like, okay, they were in this movie or they were in this TV show or something.
Exactly.
I think, yeah, it's similar, but I love that. Okay, Dr. B, this has been so fun, really so insightful. I've loved our conversation, and I'm so excited for others to hear and learn from you. So thank you so much for just giving me your time and sharing everything about your career and everything. So thank you.
Thank you. This has been really fun.
Of course.